Career highlights, I think every day kind of brings different challenges. So I think every day is a highlight in the sense that you get to work with different kinds of people, and you get to influence the way they perceive dentistry. It's not, a lot of the time they come in thinking it's really daunting and it's going to be lots of pain. So when they leave the door, with a different, idea of how dentistry is changed a lot. I think that's kind of the best thing about the job, and it kind of highlights every single day basically. But apart from that, I mean, I've worked at quite a few different practices over, especially in Australia, and here a couple of practices as well. So I think in every practice you learn a lot, and from different mentors. So I think basically, yeah, that's pretty much. Okay, actually when I was enrolled in physiotherapy, so actually dentistry wasn't my first choice, but I always wanted to do something in the health profession and something with my hands. So I kind of fell into it because my older brother did dentistry first, and he said it was actually a good profession. It was quite rewarding and challenging, so I kind of went with that. And now my younger brother's a dentist as well, so he followed suit. So yeah. Celebrity smiles. Now, if you go by textbook, kind of different proportions and that with teeth, you probably have to go with someone like Jessica Alba. But I think having a nice smile is basically a personal preference, and you basically have to look at the whole face, the whole picture. So I feel that there's actually a couple of people, like some people know Kirsten Dunst. Actually, she was rated probably one of the worst smiles, but the whole package, I think she looks good and kind of cute with her teeth, even though they're a bit crooked. Also, Shu Kui, which is a Taiwanese actress, she's got quite a gummy smile, where technically it's not a good thing to have, but it suits her whole face basically. So yeah. Top dental procedures for cosmetics we would recommend is Invisalign, braces, and whitening. Those kind of the three main ones. Invisalign is very good these days. People are a lot more aware of it because it straightens teeth without having ugly wires. So that's probably the main one that we seem to do a lot of these days. It's very conservative and not as intrusive basically. Dentistry is always changing. I mean, a lot of the basics is still the same, but there's always new materials, new equipment, lots of fancy gadgets that are coming out. So even though the core things are, sort of technical things are the same, just materials and that basically. So as a dentist, actually, we do eat everything. We are actually people, so we eat chocolate, we drink Coke. So there's nothing really we don't eat. Personally, I don't like to eat durian, but that's just me. So okay, some of the foods include like cheese and chewing gum, and also your fruit and vegetables like your apples and that. But basically, what they do is they help stimulate saliva, which buffers the acid in your mouth, so which helps prevent decay basically. Your fruit and veggies basically acts like a roughage, so it's a bit of like abrasive on the teeth as well, just slightly to keep the plaque levels down. Okay, it doesn't really matter which toothpaste brand you use, as long as it's got fluoride in it and it's suitable for adults or children, so just check on that. Main thing is your toothbrush brushing technique, so if your technique's up to scratch, then actually you can use any toothpaste and it'll be fine. When you brush, just got to make sure you cover every surface of the tooth. So for the back molars, you need to make sure you get to the front surface, 45 degrees to the gum. Okay, circle motions, don't scrub it too hard, using a medium or soft brush, and then circle motion to the gum, just like that. On the top, same thing, circle motion, inside the same thing. Okay. For the front teeth, basically you've got the two surfaces, so once again circle motions at the front and also making sure you get on the inside of the bottom teeth. Okay, top's exactly the same. I think that the philosophy that I go by is that to treat everyone as a friend and also like a family member. So when they come to the door, you treat them as how you would like yourself treated. So you're not here to sort of make them spend lots of money and that. We're basically here to help them sort out their problem and be as honest as we can and give them all the options, make sure they're informed about every treatment that we offer. So I think just being casual with them and not making them feel intimidated when they're in the chair.